Hi team. Okay, today we are going to discuss about the 5 series. In 5 series, what are all the questions and what type of the structures they will ask. In 5 series, completely related to the urinary system. In the urinary system, first question, what is the cystourethropy? In the cystourethropy, they will examine the inside the bladder and urethra and urinary system. Inside the urinary system, they will examine through the cystourethropy. Here they will ask one more question. What is the difference between cystoscopy and laparoscopy? Laparoscopy to use examine the abdominal cavity organs. Cystoscopy used to examine the urinary system. That is the difference. Cystoscopy, laparoscopy. Next, coming to the cystoscopy, when they perform any stone procedure, particularly kidney stone, urethral stone, bladder stone, particularly the stone removal, what type of the techniques? They will ask what is the ESWL full form. What is the full form of ESWL? Extracorporeal shockwave lithotripsy. What is the meaning of lithotripsy? By using the laser, they will destruct the calculus. That is the lithotripsy. In this, they will using the extra shock waves, particularly in the lithotripsy condition. That is ESWL. Particularly this procedure used in the kidney stone removal, urethral stone removal. Along the ESWL, along with they perform cystourethropy, we have built the combination CPT. Cystourethropy with lithotripsy of stone. That combo, after that we have to build this specification, particularly ESWL specification. We have to build next CPT 50590. Along with stone removal, they perform any stunt placement, we can go with the combination CPT. And here they will ask one more question. What is the placement, replacement, revision? Placement means initial, first time insertion means that call it as placement. If they perform removal with insertion of the new device, old one they will remove, new device they will insert it. That one call it as replacement. Revision means they will remove old one, they will perform repair and they will place same device. That is 1 minute. Hello. In this, they perform any lithotripsy along with the stunt placement. We have to build combination. After that, placement, replacement, and revision. Revision means they will remove old device. They perform any correction and repair. After that, they will place same device. That is revision. Replacement means replace with new device. That is replacement. Particularly in the urethral stunt, insertion, replacement, we have to check the combination. First thing, we have to build the combination. Next thing, urolift procedure. In the urolift procedure, based on the number of implants, whether one implant and two implants. In the cystourethropy, after the combination, we have to cross-check urolift procedure based on the number of urolift, whether they are placing one implant or more than one implant. And here we have to cross-check the insurance. Why? Because particularly Medicare have separate CPTs, commercial also have separate CPTs. We have to cross-check the insurance also. That is the one more condition. Next thing, prostate tissue removal. Whether they perform under the cystourethropy, prostatic tissue removal, we have to cross-check initial procedure or revision. For the initial, we have to bill separately revision. That means previous already procedure performed. Now he came for the regrowth condition. That time we will go with the revision CPT. Next thing, bladder stone removal. Particularly bladder stone removal based on the bladder tumor size. Whether it is a small, medium, large, based on the size, we have to decide CPT. We have to cross check the size also, particularly in the bladder tumor. Next, coming to the reproductive system. In the reproductive system, particularly first thing, male conditions. If physician perform any circumcision procedure, excessive skin, foreskin resection they perform, that condition call it as circumcision. Particularly in the circumcision, what type of the technique? They are using any clamps or other than clamps. With the clamps means we have to go with one CPT. Without clamps, based on the patient age, we have to decide the CPT. After that, hypospadiasis. Hypospadiasis, it is a abnormal opening in the urethra. Abnormal opening. That condition call it as hypospadiasis. Particularly in this procedure, they perform the repair. What type of the repair? Whether they perform first stage and second stage. First stage, what type of the procedure they perform? What type of the flaps they are using? In the second stage, same thing. What type of the flaps and what type of the techniques they are using? If they perform only one stage of the hypospadiasis repair, we have to cross check whether they are using any advancement flap or MNA-GPI flap or flip flaps with urethroplasty, with mobilization. So these points we have to check in the hypospadiasis repair. Next, coming to the penile processes. These are mainly two types, whether it is a inflatable, non-inflatable. Inflatable having a 3 multi-components and single component. Multi-components means having a cylinder, pump, reservoir. That is the multi-components. First thing we have to check the type, inflatable, non-inflatable. If there is any complication means they perform the repair and revision. We have to cross check all these things. Next, archidopexy. Archidopexy means testicle repair, uneven testicle. That time they perform the repair. We have to cross check incision, whether it is a abdominal and scrotal or inguinal incision. Along with archidopexy, they perform any hernia repair. We have to cross check. At the same time, archidopexy with hernia repair they perform at the same time. We have to cross check the incisions. Both are different incision means we can code both. If same incision they perform archidopexy, hernia repair means we can report only archidopexy. No need to bill hernia repair. Next thing, female reproductive system. In this, they will ask mainly hysteroscopy, hysterectomy procedures. In the hysteroscopy, they will examine the uterus. That is hysteroscopy. In the hysteroscopy, they perform polypectomy, dilation cutters, and leiomyomectomy. We have to cross check the condition. Based on the condition, CPT we decide whether they perform polypectomy. Also, we can go with the same CPT. If they send the polyp to path report, in the path they mention leiomyoma, same polyp only leiomyoma means we can change the CPT. Based on the condition only, we have to change the CPT. So next thing, hysteroscopy, hysterectomy, hysterectomy, uterus, ectomy, removal of the uterus. Particularly hysterectomy procedures. Hysterectomy procedures mainly three types: total hysterectomy, partial, and radical. Total hysterectomy, they will remove entire uterus including the cervix. Partial means they will remove only upper portion of the uterus. That means they are not removing any cervix. With the cervix means we can consider total. Without cervix, they perform only uterus removal. That one, partial hysterectomy. Next, radical means along with uterus, nearby structures. What are all the nearby structures? Ovaries, fallopian tubes, and cervix and some part of the vagina. They will remove all these parts. That is radical hysterectomy. Next, coming to the abdominal hysterectomy, supracervical hysterectomy, vaginal hysterectomy. Before that, we have to cross check the approach: open approach, laparoscopic approach. For the laparoscopic, how you identify? They perform the laparoscopy, but they are not mentioned. This is the laparoscopic approach. So that time we have to cross check some key terms. First one, port placement. Second one, trocar placement. Third one, camera placement and scope placement. These all call it as laparoscopic approach. In the hysterectomy procedure, whether they perform open approach, laparoscopic, both are also have a separate CPTs. We have to cross check first thing. Next thing, type of the technique. What type of the technique? Whether it is a total abdominal hysterectomy or supracervical hysterectomy, vaginal hysterectomy. In the abdominal hysterectomy, they will make incision through the abdomen. They will remove the hysterus from the incision only. That is total abdominal hysterectomy. Supracervical hysterectomy, they will remove the uterus portion into the abdomen. That is supracervical hysterectomy. Next, vaginal hysterectomy. Vaginal hysterectomy, upper portion of the uterus they will remove through the abdomen. Lower portion of the uterus they will remove through the vagina. That is vaginal hysterectomy. So these all points we have to check. In the interview also they will ask what is the difference between partial, total, radical. Partial means they will remove only uterus. They are not removing any cervix. Total means uterus with cervix. Radical, uterus, cervix along with nearby structures such as fallopian tubes and ovaries. They will remove all these things. This all we have to check in that. Next thing, 6 series. In the 6 series, first thing they will ask cataract procedure. How you differentiate simple cataract versus complicated cataract? Simple means they will remove the cataract by using the laser. After that, they will place the intraocular lens. Only that procedure only that they are performed. That one call it as simple cataract extraction. Now coming to the complicated cataract extraction, along with the cataract removal, they perform some additional techniques. Suture supportive intraocular lens, iris expansion device. Second thing. Third one, posterior capsular excis. They perform only anterior capsular excis means no need to consider as a complicated. When they perform posterior side only, that one only we have to consider as a complex. Along with cataract, complex cataract, we have to check the combinations, whether they are using endoscopic approach or not. Next thing, whether they are placing any instrumentation like any mesh placement, any stunt placement. We have to cross check all these things. Then only we have to decide the CPT. Next, in the eye procedure, next thing, strabismus surgery. In the strabismus surgery, based on the eye muscle, whether it is a horizontal and vertical, based on the muscle only, we have to decide the CPT, strabismus surgery. When they perform the strabismus surgery, mainly in the two type of the conditions, esotropia, exotropia, abnormal position of the eyelids. So that time they perform the corrections. We have to cross check these all points in the strabismus. Next thing, blepharoplasty procedures. Particularly in the blepharoplasty procedures, they will remove the only blepharous, only skin only they will remove. They are not removing the excessive skin. If they perform excessive skin with muscle, they will remove. Muscle means they will remove skin with any fatty tissue also. That one we have to build the excessive blepharoplasty CPT. If they perform only skin only, they will remove. That one go with that blepharoplasty only. Both blepharoplasty procedures they perform in the upper eyelids. In the eyelid procedure, mainly we have to check the lateral test, whether it is a unilateral procedure, bilateral procedure. Unilateral means we can append E series, E1, E2, E3, E4. Bilateral means we can go with the 50 only. These are the eye procedure. Next, coming to the ear procedure. In the ear, what are the procedures, what are the conditions? First conditions, otitis. When we are getting otitis condition, first thing we have to check the any fluid is there or not. If fluid is there means what type of the fluid, whether it is a purulent fluid and non-purulent fluid. Based on this, purulent means have a separate set of the CPTs. Non-purulent have a separate set of the CPTs. After that, we have to cross check whether it is a mycoid and serous type. All these things we have to check. After that, we finalize the ICD. Next, coming to the CPT, first thing they perform the cerumen removal. Normal cerumen removal, it is a part of the surgery. Any surgery, part of the all surgery, cerumen removal. When impacted cerumen is there, that time only we can consider it is a condition. That time we have to build the impacted cerumen removal CPT. Here we have to check only they perform the normal with the help of the any instrumentation. These points we have to check. If they perform along with the instrumentation, we have to give the combination. Next thing, this is the first procedure. Next procedure, if they perform any myringotomy, that means incision of the myringes. They will perform only incision. That time we can go with the only incision CPT. Next, coming to the myringoplasty. In the plasty, they perform the tympanic membrane repair. If they perform the repair, we have to check the technique, what type of the techniques they are using, gel foam or paper patch and some other techniques. Based on this, we have to decide the CPT. And next thing, tube placement. After this, they are performing the tube placement. If they performing any tympanostomy tube placement, first thing we have to check the along with any major procedure they performed or not. Why? Because majority of the times it's showing edit. So that time we can go with the only procedure CPT. And next thing we have to check whether they are placing tympanic tube or removal. We have to cross check. Majority of the times removal, no need to bill. When one and only CPT, one and only procedure of the tympanic tubes removal, that time only we build that CPTs. Remaining all major procedures, that is the part of the procedure removal. After tube removal only, they will examine the ear. They need to perform the procedure. Not only this, any hardware removal procedure, before they are placing the some implantation. Now he came for the some additional procedure. That time, once they will remove that hardware, then only they are continue the procedure. So in that condition, no need to build the hardwares. Why? Because it's a part of the procedure. No need to build separately hardware removals. So these are the ear thing. Next, thyroid procedure. Particularly in the thyroid procedure, first we have to check partial thyroid lobectomy or complete lobectomy. Lobectomy. First thing, lobectomy. In the lobectomy, they will remove partial lobectomy, complete lobectomy. Next thing, complete thyroidectomy, they are performed or not. So these all points we have to check. After that, check the lateralities. Next, coming to the spinal procedures. Particularly in the spinal procedure, first thing we have to check nerve block procedures. If they perform nerve block, when they perform the nerve block means after completion the procedure. Before also they are performing the nerve blocks. That is the part of the procedure. Particularly they performed after the procedure. That time only we are building the nerve blocks. That too, that nerve blocks performed by the anesthesiologist or CRNA. That time only we can build. Next thing, whether they are performing nerve blocks, we have to cross check what type of the nerves, whether it is a interscalene and subscapularis, supraclavicular. Based on this, we have to decide the CPT, brachial plexus and tab block or scalene block. So based on this, we have to decide the CPT. Next thing, spinal procedures. Particularly in the spinal procedures, they perform what type of the techniques, whether they perform any laminotomy or laminectomy techniques. Laminectomy means they will remove entire lamina. That is laminectomy. In the laminotomy procedure, by definition of the laminotomy, it is a incision only. When they perform partial laminectomy, that one we can consider as a laminotomy procedures. Before laminectomy procedures, we have to cross check the medical necessity. When herniated disc is there means we can go with the herniated disc procedures. When medical necessity having a stenosis condition, we can go with the stenosis CPTs, particularly in the laminectomy procedures. Next thing, they perform any injection procedures in the spinal, whether it is a facet joint injections or epidural injections. Based on the location, we have to decide the CPT. Next thing, majority of the times for the add-ons does not have 50 modifier. Why? Because we have to build twice, particularly in the spinal injection CPTs, facet joint injections and epidural injection does not append for the 50. We have to build add-on twice RT LT modifier. After this, neurostimulator, particularly they perform type of the neurostimulator. First thing we have to check type of the neurostimulator. what is the use of the neurostimulator? To relieve the pain, to control the pain. Based on the location, we have to decide that whether they are placing spinal neurostimulator and cranial neurostimulator, hypoglossal neurostimulator, gastric neurostimulator. Based on the location, we have to decide. And one more thing, we have to check the condition. Lower back pain, particularly having a lower back pain, they are performing the spinal instrumentation, spinal neurostimulators. Cerebroplasty and epilepsy and seizures, that condition, that time they perform the cranial neurostimulators. Any obstructive sleep apnea, that time they're performing the hypoglossal neurostimulators. Next thing, when any gastric related condition, gastroparesis, that time they're performing the gastric neurostimulators. In the neurostimulator, first thing we have to check it is a complete system, incomplete system. How you differentiate complete or incomplete system? Complete system means generator with electrodes, that is the complete system. Incomplete means only generator or only lead. Next thing, whether they are performing placement, replacement and revision. If they performing placement, number of the leads we have to cross check. Based on the number of leads, we have to decide the number of CPTs. Each lead we have to build separately. Next thing, particularly in the neurostimulator, we have to check the approach. What type of the approach? These are the neurostimulator procedures. These are the interview questions they will ask in this topic only. Any other doubts in this?
One doubt.
Yes.
We have discussed that blepharoplasty, right?
Yeah.
For that, we will go with one series code, no? When we will code blepharoptosis, that 6 series 67901 code. Difference between blepharoplasty and blepharoptosis, I'm asking.
Particularly based on the condition. Patient having a ptosis, broad ptosis, that time only they are performing. So that time we can go with the 6 series. There is no medical condition. That time we can go with the 5 series. Rhidectomy. They are coming for the cosmetic surgery. There is no condition. Only they are coming for the cosmetic purpose. That time only we can append 1 series. Any other?
No.
Yeah. Okay. Okay, tomorrow I will ask questions. We need to answer that. Please be prepared, and this weekend maybe its class going to be end. Okay. Okay, please be prepared on these questions. Tomorrow I will ask. Each and everyone have to answer. Okay, bye. Bye bye.
Okay.
Okay. Thank you. Thank you.